in-person audience.
Did you know that depression affects 30% of American college students? It's a very serious disorder that a lot of college students get because we all fall victim to the stress and the challenges that college brings with it. And it's our first time away from home, and we're trying to figure out everything on our own, so we don't always get the help that we need right away. So I think it's very important for all of us to know the symptoms of depression, how we can get help with depression if we feel that we are depressed, or if you think someone else you love is depressed, and just to know that you aren't alone and that there's always someone there that will be able to help you. So what is depression? Depression is a mood disorder, and it's accompanied by persistent feelings of sadness. You would feel it for a long period of time. It's very extended. It's not just a couple of days like you normally are if you are sad. It affects your thoughts, your feelings, your behavior. It can affect how you do in school. It can just affect your friendships and your relationships. It puts a big toll on things like that. So there's a few different types of depression. The main three types are major, minor, and dysthymia. And major depression is just like, it lasts for a very long time, and it has all the symptoms that you can get, which I'll get to. Minor depression is similar to major depression, but it lasts for not as long. And then dysthymia is similar. It's kind of in between major and minor. There's also a few other types of depression. There's postpartum, which is when a woman becomes depressed after giving birth. And then there's SAD, or seasonal affective disorder, and that is caused by being depressed in the winter and fall months versus the spring and the summer months. And a really cool treatment for that is you can be treated in a sun lamp to give you the effect of a summery weather. So I thought that was something that was cool. Okay, so what are the signs and symptoms? There are a lot of symptoms for depression. They include feeling of hopelessness, loss of interest in things that you used to enjoy, loss of appetite or weight change. Your weight can fluctuate. You can either gain a lot of weight or lose a lot of weight. Changes in your sleep pattern. You can become an insomniac, or you can just sleep all the time. There's irritability. You get mad easily. Fatigue. You're always tired. Trouble concentrating, and that's where it would hinder your ability to perform well in school. And then there's also unexplained aches and pains. Sometimes you get stomach pain because you're very anxious, or you just feel like your body hurts. Some of these symptoms are common in everyone, but they do vary from person to person. And even though some of these symptoms seem like everyday issues, if they're all paired together and you have a lot of them at the same time and they last for a long period of time, then you know that you probably need to go talk to your doctor and get some help for the way that you're feeling. Also, with depression, there's a very high risk for suicide and suicidal thoughts or self-harm. Suicide is the nation's third largest cause of death. So talking about suicide is really important, especially with the topic of depression, because if you're away from college and you don't really have your family to talk to, you might think there's nowhere to turn, and you might sink to that level. But just know that there is people to talk to. This is the Depression Help Hotline. It's 1-800-273-TALK or 8255. So just know that you can talk to them and they can help you a lot. And if you have a friend or a family member that may be depressed, be an open ear to them, because that'll help too. So with treatments, it's basically, there's two different types of treatments. There's medication and therapy. They cognitive behavioral therapy, or there's another kind of that they don't really use as often. There's also medication which increases the dopamine or the norepinephrine or the serotonin levels in your brain, which make you increase your mood. They don't really know how it works. They just know that it increases your mood. Sometimes your doctor will pair both of them together because they work better together. So things that you should remember is that depression is a mood disorder. It's not just an everyday thing. It is an actual disorder. If you need to, you should seek out help if you feel it. You can talk to your doctor. There's campus doctors. There's campus counselors that should help you. There's always someone to talk to, like I said, with the suicide hotline.